anytime I'm left in a place where I shouldn't be, leave a card. I leave a help me with HIPAA card or my business card, either one. So if you stumble upon one, well, you know why. But
I found one in the bathroom one time.
hey.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Card and Compliance. How's it going, Donna?
It is going well, David.
Very good. So, we've got a boot camp coming up, and I want to push this thing. So, we're going to dive right into what this boot camp is. We're getting a lot of feedback about it, people asking questions, and so I want to make sure we dive into that first thing about what the boot camp is, how to get more information, how to attend, and all that kind of stuff. And we're also going to tell you how to get a $100 gift card and what that's all about in just a minute, too. So hang in there. So,
oh, wow. And then we have a topic.
No, we're not going to do that. We're going to skip the podcast part. So, for those of you interested in the HIPAA boot camp, what it's going to be is a absolutely intensive compliance officers 2-day workshop to just get you in there, tell you everything you need to know about HIPAA, about how to deal with all the compliance aspects, and just get you ready to do it. And then we're going to not just tell you how to do it, but we're actually going to show you how to do it and give you all the tools you need to make sure that you're ready to take that back to your practice and make it all happen. So this is going to happen on May the 11th and the 12th. And that's going to be in, was it Stone Mountain, Georgia? Is that right?
Yeah, Tucker, Stone Mountain. On the Tucker side of Stone Mountain.
The Tucker side of Stone Mountain. We'll confuse everybody. So it's going to be...
It's a thing. If you live here in Atlanta, it's a thing.
It's going to be in Donna's backyard. And but we've got a nice place that and we will be providing breakfast and lunch both days. It's up to you to provide everything else. And we're going to make it happen. So if you're interested in learning more, you can go to one of two places. One is thehippabootcamp.com. The other is helpmewithhipaa.com/bootcamp.
So they go to the same place.
They go to the same place, yeah. So, but if you hit either one of those, it takes you to the same place, get all the information that you need. If you need more information, then reach out to myself or Donna at contact@helpmewithhipaa.com. We'll give you some more information about that. So seating is very limited. We do want just a small group of people because this is more of a workshop environment. It's not one of these things where you just listen to people talk on the stage and then you get to go home. We're going to get really, really, as Donna would say, intimate with you.
Up in your business.
So we're going to keep the size really small. So sign up before we run out of spaces. I know we have a lot of people who are interested in that. And this will be the absolute cheapest it will ever be. I can guarantee you that.
Well, 2 days and you get breakfast and lunch included, and 2 days of putting up with us. I guess some people say that we should pay them, but we're not. They're going to pay us.
Yeah, you get to spend some time with me. That's worth something.
Yeah, really.
So do you have any speaking engagements coming up you want to talk about?
Yes, I do. We are at the last few planning weeks for the Georgia MGMA annual conference in Hilton Head Island, South Carolina. What? I'm excited about doing that. May the 2nd is the day I'm speaking. So it's, as I've said before, it's Wake Up with Donna Day. And I have told many people this is a mainframe that does boot slowly, but hopefully I'll manage myself that day. And then we got the boot camp, of course. And then in June, I'm doing a visit down to Valdosta, Georgia for the South Georgia MGMA guys, and looking forward to that. I've been down there with them before. And then in July, the Atlanta Association of Legal Administrators. I know that's overly exciting. And October and November, I've got dates set aside for North Metro MGMA and the Georgia Association of Orthopedic Executives annual conference. So we've got some stuff we're talking about doing in August potentially. And then, of course, September and December is all where I don't have something yet. But, be a good time to take a day off, I guess.
So find you something to do. Because, idle hands with you. Oh, Lord have mercy.
Well, and you're speaking too, though.
I have one coming up in Washington, D.C. in September. Had one coming up in Charlotte, but I think that's kind of iffy. So don't even want to mention that at the moment. So I think that's it for now that I can think of.
It's it for now that you can think of.
I'm sitting here looking up going, wasn't there something? All right. So that brings us to the $100 Amazon gift card, which I'm hoping I win, honestly. So even though you said you can't give it to friends and family, which, we've already discussed the fact that I'm neither to you. So, but for the Amazon gift card, what we did is for our 100th episode, we decided to start a little campaign that will last for a couple of weeks. And then we're going to make a drawing at the HIPAA boot camp for a winner for the Amazon gift card. But you have to have your name entered in. So this is what I'm about to tell you. There are ways that you can get your name entered in. So there's a way that you can get 1 entry, 2 entries, 3 entries, and even potentially 4 entries. So the way to get 1 entry is you need to review or recommend us online. Send us a screenshot of that, and that can be iTunes, Stitcher, LinkedIn, wherever you do that at, so we can validate you've done it. You can also send in a question via email, social media, SpeakPipe, etc. And you can do a shout out to us on social media, Twitter, Facebook, LinkedIn, whatever. Any of those things will get you 1 entry into the drawing.
Yeah, we're not doing a hashtag kind of thing. It's actually shout out to @HelpMeWithHIPAA on any of those. You should find us on Twitter, Facebook, and LinkedIn @HelpMeWithHIPAA.
All right, very good. So to get 2 entries, here's what you need to do. There's a couple of options. 1, complete the listener survey, which is at helpmewithhipaa.com/survey. And add in the notes. What do you want to add in notes?
Just say, give me $100 and put your email address in there so we know it's because the surveys is anonymous and you can keep it that way, or you can give us your email because that's the only way we're going to know how to draw your name.
Other way was we'll draw your name and we won't give you the prize. It's because we won't know who to give it to you. The other way is you can send an email to us. And here's where you have to kind of be a long-time listener or have stumbled across something. But there is an episode in which we joked about sending in an email about me. And if you know what we're talking about, then send that email in and we will give you 2 entries. Now, the way to get 3 entries, very simple. Sign up for the boot camp. Very, very easy. Just go sign up, pay your money. You get 3 entries. Absolute best value going.
Nice.
And then the 4th way is we've kind of decided that if you can come up with something super creative, especially if it gets you on any major network news show, we'll give you 4 entries into the drawing. So there you have it. That's how you can get your entries into the drawing for the $100 Amazon gift card. And we'll draw it at the boot camp and we'll notify the winner shortly thereafter.
All right. That sounds like a good loop.
That brings us to a question of the day. So last week and last show, you actually made a comment and brought up a question, and that's what we're going to dive into more today because I think it was a great question you brought up, which is, are we creating a crisis of trust in healthcare? And I think the answer to that is absolutely we are, but we're going to talk a little bit and have a discussion about why that is and what some of the statistics are about that, because there are people out there actually asking that question. And some of the statistics are kind of alarming. If you're not paying attention and things are going wrong and you're a healthcare provider, you could really be losing a lot of patients. So that's what we're going to dive into today.
Yeah, the topic du jour.
Yeah.
Is well, actually, one of our business partners sent an email after one of our previous episodes and said, are we creating a crisis of trust in healthcare? And really making the point that we should have that discussion in an episode. And Well, all you have to do is draw that line, and then it's a challenge for us. I had been looking at several different angles of having that discussion in general, and so we kind of merged them all together. Hopefully, we've patty caked a lot of different things here together, so that we can look at and say, at least discuss the fact, are we creating a crisis of trust in healthcare? I know it's something that I have talked about repeatedly in training classes when I'm working with clinical staff, especially to say, remember, if they don't trust you, they're not going to tell you. They hold things back because they don't trust you. And if they hold things back, then you can have all kinds of issues that could be prevented or corrected, or you can stop something before it becomes bad. But because they're not trusting of being able to say things that they don't want out somewhere, then they don't tell even the providers that they want to tell. They make the effort to go see you, yet they don't feel that they can tell you everything because certain things they want to keep private. And, doctor-patient confidentiality seems to have gone out the window when you're getting pounded every day with all of these stories of breaches and ransomware and, new notifications. And they just came out with the tallies looking at the first quarter of 2017, and March had more data breaches reported than January and February combined in healthcare. So that's not looking good statistically. It's not really working for us. But clearly, it's something that the healthcare industry needs to address. Is this starting to make people not trust, the healthcare industry as a whole? And who is it that they distrust? And, everybody's got in all these built-in conspiracy theories. But personally, it's something that you and I struggle with often when we go to we've talked about it before. What do you do when you go and somebody leaves something where it shouldn't be left? And you're like,
yeah. Do you bring it up? And how do you bring it up? Do you ignore it? Do you try not to look at it?
Yeah, I like to, anytime I'm left in a place where I shouldn't be, leave a card. I leave a help me with HIPAA card or my business card, either one. So if you stumble upon one, well, you know why. But
I found one in the bathroom one time.
Hey. Was it in the toilet? Never mind. Let's don't go down that path. The FCC will cut us for sure. I'm sorry, our own internal one, the real one, doesn't care about us most of the time. But I can tell you that we did have a study come out from Healthcare IT News that said 50% of consumers say they would find another healthcare provider if they were concerned about the security of their medical records. So we're not just talking about their healthcare, we're talking about your business. As a healthcare covered entity or a business associate, you're both affected.
So this means that, there's a potential that if there's a breach or something that happens in your practice, that you could lose 50% of your practice. That's that's kind of scary.
Well, I was just doing a training class last week, and I mentioned one of the names of the practices that here locally, let's just say they were in the news a lot last year. We're not going to go any further, but and somebody in the back said they're still seeing patients. I mean, there's this perception that they're a major catastrophe like that, a large breach where it's in the news, and you're not made to look well, means you're not going to do well very long. And I know that I've spoken with competitive practices in the same area, and many of them say, yeah, we're picking up a ton of people that are leaving there. So that goes back certainly not.
That goes back to what we tell people all the time, which is this is not about compliance. It is about patient care. And if you're not treating this as a patient care issue, but your patients are looking at it as a patient care issue, then when something like this happens, that's how it explains why 50% of them or more are going to leave.
Yeah, they're going to consider it. And there's another study. This one came out near the end of 2015. So it was kind of after when the real year of the healthcare breach happened, is what they said. 2015 was. That's when the Anthem breach really made all the news, and it was overwhelming. But I think really in the end, 2016 is a bigger deal because of some of the things that happened. But hopefully 2017 won't be. At any rate, the 2015 study said that 45% of patients are moderately or very concerned about security breach involving their personal health information. So that's before they heard about it in the news every day.
Wow.
And it wasn't as big as it was in 2016. 21% actually admitted then, before it was as bad as it is now, they actually admitted 21% withhold personal health information from their doctors due to security concerns. So that was then. I can't assume that number went down. I haven't found a more recent where it's asking exactly these questions all in one. So I'm watching for one because I'm interested to see. And of course, all these studies, it matters who you ask. But I did find it interesting. Only 8% of the patients always read doctors' privacy and security policies before signing them, and 10% are very confident they understand them.
Wow. So 90% of the people are really not sure what they're signing.
And now that we have our Help Me with HIPAA shirts, it's really cool to wear them into medical facilities and ask for an NPP. People's eyes will pop right out of their head. They're running around. They're looking in drawers and slamming things, and it's right there on the wall is the quickest answer. But you can freak them out. Yeah, I do HIPAA. But yes, there is another problem is that people aren't really sure what's supposed to happen with their data. In their minds, you're not telling anybody. They have no idea how the medical industry works. Mm-hmm. But then they had the same number, 54%, moderately or very likely willing to change doctors as a result of a patient data breach. And they're more likely to change doctors if their medical staff caused the data breach, and the least likely to change it if the hackers were responsible. Well, we just talked about, so they're like, well, those hackers you can't do anything about but your own people. But not too many weeks ago, we just talked about insiders being the biggest problem and the snooping and all of these kind of things. Insiders are going to create that environment that allows people in, or they're the ones that will take it with them. We hear all these horror stories all the time about things that happen, and everybody's like, oh, my staff's not going to do that. How many times you hear that? We've all, that is the scariest thing at all. It's not going to happen to me. It's not going to happen to me. Mm-hmm. And so we had, you hear all of these horror stories, and one that's really kind of bothering me of late is a case where an employee who had been there forever gets divorced, gets a new boyfriend. The new boyfriend moves in and then begins, as often happens. It was going to be a great episode when it comes to the audio, but it's going to be a horror story because the new boyfriend knew she worked at had access to medical stuff, and told her that she needs to start bringing these records home to be used for identity theft. And when she didn't do it, he beat her. And every day that she didn't bring them, he would beat her. And what are you going to do then? How are you going to say that would never happen to me? Are you going to say that honestly? The people that worked with this poor woman, they knew something was wrong. Mm-hmm. It never occurred to them that that's what was going on.
No, that's a new one on me.
Yeah. So, and there's many, many scary ones, and you don't know what's going on in people's lives. And that's when these people that say, well, they've worked with me for 10, 12 years, that will never happen. You don't know. You don't know. And that's why you need to be checking and paying attention. And there's some other cool stuff that we've learned about that you need to do, because the hackers are now blackmailing people, and it's crazy what's going on.
Mm-hmm.
So knowing that if your people are involved, that's when they're most likely to change. It's just more and more news of why we're running into this problem, because you're airing your dirty laundry with breach notification. It's essentially what it is. Believe it or not, it is. So I think the next thing that I plug in here was an article, a blog, article that said, take these 6 steps to alleviate patient anxiety about data security. And I thought, interesting.
Mm-hmm.
Very interesting, especially when it's written by the director of industry relations. So I'm not really sure exactly. I don't know this individual. Haven't heard her speak, but I thought it was interesting what she was writing, and those 6 steps of transparency, having a dialogue, security technology, training and policy, system backup and recovery, and familiarity and comfort. So let's talk about those a little bit, David.
Oh, wow. Well, you know where I'm going to go with some of these.
Yeah, I know, really. Yeah, it's not a bad concept. I mean, I'm all for the article and the point and trying to get the attention. Totally for it.
Oh, yeah. It's not that it's a bad thing at all. When you kind of going back to the statistic that you read earlier, which was 45% of patients are moderately or very concerned about security, I wish that would say 45% of practices are moderately or very concerned about security. Because I tell you, it's you see it as much as I do. You go out, and for every 10 people you talk to, you might have 1 or 2 that actually are concerned. And the other, 8 or 9 just, they're giving it lip service, or it's on our radar and we'll get to it when we get to it. Or, how can we just spend $10 a month and be HIPAA compliant? I mean, it's all these different excuses. And what it boils down to is that they just don't want to do it. They're not concerned enough about it yet.
Yeah, it's always, I'll pay for anything if I think it's important enough. What was the quote you gave me that somebody told you today or this week? Last week? Our doctor seriously does want to do HIPAA or something.
Right. Yeah. Yeah. The doctor is seriously wants to dive into HIPAA and get this stuff done. He just doesn't want to spend any money. It's like, okay. I mean, even if you don't buy any product or service, it's still going to cost you money in the man hours that it's going to take to get it done. So there's a cost involved.
Yeah. If especially if you're going from nothing to something.
Well, here's the funny part about it was that, part of what we're talking about is, whether or not this person should pay for some kind of training or whatever. And so they actually said to me, well, as much time as I've wasted trying to figure this out on my own, I could have paid for the training twice over already.
I know.
So,
but they don't get that. The number of times it's like that we've actually had people cry and say, well, the doctor told me I could figure that out myself.
I know the compliance officers are like, yes, we wanted this, we want it, please. And then, but they're not the ones writing the checks and doing all that. So,
well, that's why I've seen a recommendation of always having your compliance team. No matter how small you are, you should still have a compliance team. It's not on one person. And then on that team, you need to have somebody who's responsible for writing checks who actually has to understand it.
Mm-hmm.
And I thought it was a brilliant idea. And I can say for certainty, it does change the environment when you do that. I've seen it happen too many times. It's like, well, no, you have to do this, 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 and this in order to be sure you've secured your mobile devices. And I don't care. That has nothing to do with HIPAA. We're just talking about security. So that's the part. They see it all as HIPAA, and it's not. It's security. It's privacy.
That's true. So let's talk about these 6 steps to alleviate patient anxiety about data security.
Mm-hmm.
So now this is not alleviating the practice's anxiety. This is alleviating the patient's anxiety. So this may create some anxiety on the practice. So number one is transparency.
Yeah, the point in the article was that older patients are not going to be as tech savvy as the younger ones will be, but they still want to know. I mean, we've talked before about the oversharing that happens with some of these younger folks.
Mm-hmm.
But, there's even stuff they don't want out there. And the ones that are becoming more aware are starting to back off on that a little bit. At least we hope that trend continues. But the whole point was to say, look, we're collecting this data to take care of you, not to blackmail you.
Right.
So the older generations who aren't tech savvy, or anybody that's not tech savvy, they're paranoid about giving you all this data. And then they're like, why do you need it? And the younger ones, they know you're collecting a lot of data and they've heard all these horror stories. So why do you need to know all of this stuff? And, it's hard for people to get the actual value that comes from data.
Mm-hmm. And the transparency side leads us to number two, which continuing down that same path, which is creating a dialogue and maintaining a dialogue with your patients.
Yeah, this one's a little tricky.
Mm-hmm.
And this one kind of references another article that I had picked up explaining why not to use paper. And I think there's plenty of doctors that we can have that same discussion about the value of doing it electronically rather than on paper. And instead of just assuming that everybody thinks that's better, talk about it, explain it. Say, okay, well, number one, how do you encrypt paper? Shredder. We can track and we know where it is and we know where the data is, but on paper, I can't tell you the number of times back in the day that I would get a call and they'd say, you got to help me file this claim because we just found a whole bunch of charts in the doctor's golf bag. I mean, it was for real. Or it was in the trunk and it got pushed up under the golf bag. Or I don't know why golf bags were often, the clubs were involved in those discussions, but there's so many things that can go wrong with the paper and you don't know where it is and only one person can see it. If they have multiple locations, there's no easy way to get it from point A to point B. So if I need to know something and somebody can look something up in a computer, that's way faster than finding paper, making a copy, trying to fax it, all of those kind of things. There's lives that are saved between those two things.
Right.
And anybody try to read a doctor's handwriting? Hello? Anyone?
Right.
Well, I ain't got nothing to say about that because there's a reason I use the computer and don't write things down.
So number three, this, like I said, this is from the patient's viewpoint, but the other one, number three, is security technology. So, it talks about, being necessary to look at the technologies that you have in place for your patients and then discuss the security aspects with them. So I know, patient portals have certainly become big in the past couple of years. And, you've got patients that are older and you're telling them that there's a patient portal and they can go log into it and all this kind of stuff. And that can be quite daunting for them.
Oh, yeah, that definitely gets them overwhelmed. I don't want to try to do that. And I don't use a computer and those kind of things. So there's plenty of those cases. But, if you're able to say to them, we take it seriously. We have these people that we work with and we make sure that they're doing their job, and we work with carbon compliance and we work with HIPAA certified. No, don't say that. No, but to say that we go out of our way, and whether it's working with carbon compliance or Carolina Computer or anybody, is to make sure you make the point of explaining how seriously you take this. Because some people don't take it seriously.
Right.
And that's a whole big, there's a gap there between how you can define how seriously you take it. And if you're not taking it seriously, there's nothing we can do, but at least talk about it.
That's true. if you get to, the thing about it is, if you know you have to talk to your patients about these things, then you might be more apt to actually do them.
True. Yeah, that's a way to look at it.
And that brings us to number 4. Oh, this is training and policy. So, your patients probably don't know this, and it's probably a good thing, but you are the weakest link because you're the person, your people are the weakest links. And, the only way you can strengthen those links is by training and policies and procedures. So if you don't have policies, procedures, and training in place, then you're not helping things. But
it's
you
the
want
people.
Exactly. But you do want to be able to share with your patients about what you're doing with security training and how that affects your environment.
Well, that's a lot where we talk about having that culture of compliance, and it's really more of a culture of security and privacy.
Mm-hmm.
And if you have that culture, then, it's not like the physicians have to have that conversation with the patients. The staff should be having that conversation with the patient at every level. They should be saying, instead of saying, I'm sorry, but I'm not allowed to do that, or this or that, you can say, we take security really, really seriously, so we're limited on some of the things because it's not as secure. Say it in a positive way. And it's the same thing when you talk about the training that the staff has to explain and make people feel comfortable that you are taking it seriously, that protecting their information and their health is important to you.
Mm-hmm.
And we have the policies in place. And don't be rolling your eyes, it's HIPAA's fault or all of this. You need to make these people feel better about it, not worse. You need to make them feel better about your ability to protect their information. And bashing a law has absolutely nothing to do with you protecting my information. Nothing.
Yeah.
It's like, hey, there's a moose. Don't look it over there, the sleight of hand kind of thing. So,
well, it's, we've talked about this before too, that, HIPAA and things like HIPAA wouldn't be in place if people were doing these things already. And that's why there has to be regulations about it, because unfortunately, left to their own devices, people are going to do the minimum necessary.
Well, we saw that. I mean, HIPAA was voluntary.
Mm-hmm.
It was a voluntary program, and look where it got us. We still don't have people doing what they should have done voluntarily.
Right.
They still refuse to do it. Well, we had plenty of time to do this, and had we done it, we wouldn't be where we are today. It's almost a certainty.
Well, even with all the crazy fines and everything we have, you still have a massive number of people that still aren't doing what they should be doing with it.
Well, HIPAA schmippa.
Yeah, I know. I've heard it.
So I know. So it's not about those things. It's about your patients, and they're scared to death because they've heard all this crap. So anything you say that only makes it worse, while they may not tell you right then and there, you're only reiterating to them that they shouldn't share information with you.
Mm-hmm.
Or they shouldn't do business with you. Even worse.
And when you have a big sign in your office that says, we have a nice new security policy, HIPAA security policy, and HIPAA's misspelled.
Well,
that's just funny.
Some of us will be like, yeah, but you have seen that. And yeah.
Yeah, the public they're getting to be a lot more educated on this stuff, and you're not going to be able to get by with what you used to be able to get by with.
Mm-hmm.
Which brings us to number 5. System backup and recovery. Now, not necessarily related to this, but it's a story that I'll share. I won't mention any names to protect the guilty, but there was, a compliance officer called me today, and I felt so bad for her because she said that she was trying to create a policy and procedure manual for this practice that she works for. And she said, unfortunately, I called the previous compliance officer / office manager, and she said that we had a manual, but it was saved on the computer that crashed and not backed up anywhere. So you got to start all over.
Oh, that hurts me.
Never was printed out, never was saved anywhere else. Just we had one and it's gone.
It's with the okay.
So anyway,
yeah, you haven't told me that one before. Oh, ow.
yeah.
Ow.
So the point of this is, you should be able to, reassure to your patients that, you have a backup plan in place and you have a way to recover your business and make sure things are operating. I mean, we just had a big problem here locally a few weeks ago where through Insider, I found out somebody didn't just reboot the wrong piece of equipment at the local ISP, which took down 4 counties. No, he didn't reboot it. He pressed the reset button and held it in.
Oh, no.
So it went back to factory. So it took them 4 hours to reconfigure this piece of equipment, which knocked down the internet for 4 counties and everybody in it. So,
that's what happened.
There again, you should have a system in place to address how you're going to handle that.
Yeah. I didn't know that. So that just that makes it worse. And you don't want to be that person. That's like the guy that touched the ball at the Cubs game. So he's bless his heart, But the other point on this is where they say system backup and recovery. It's more important to not just make patients feel like, okay, well, we're backing it up, but also that if anything were to go wrong, we're prepared to keep working and caring for you and have your information available. We have a business continuity plan, and you don't have to call it that. It's a business continuity plan and a disaster recovery plan, but you just say, we're prepared if things go wrong, that we know taking care of you is the most important thing we need to do.
Which brings us to 6, which is familiarity and comfort.
Yeah.
We want you to feel very good about yourself.
Yes. Yeah. Feel good about using the portal and all of that. But the other thing is if you're going so far as to build those relationships with the patients, and so many people that are in healthcare, hats off to you, because it's a really tough job. You're doing things and you're having to care a lot about things that are really hard to do, especially those that are in things like oncology and pediatrics, and those are hard jobs. So never do I think that they are not. I want to make sure you're caring for your patients and your company and all of that. And I was thrilled when I'm getting my new eyeglasses, since I broke them again, to have this young guy that's there, and he's helping me with them. And he understood. He said, well, you have to protect the patient's information. That protects me, my patients, and my business, doesn't it? He's really young. I mean, he's studying. He's in school. And I was like, you're my new best friend. So shout out to Chris. I was so proud of you, Chris, for answering me that well. And I scared him in a lot of other ways. But that familiarity and comfort goes beyond just making me feel comfortable as a patient with your care, but extend your care to, hey, now, do you need me to help you teach you how to use the portal so you can look stuff up? We have all of these ways. But being aware of that goes back to staff training and culture of privacy and security and understanding it's about patient care. But teaching them that the technology is not terrifying, it's not a bad thing, and it can save lives in so many ways. And it certainly makes it more affordable for you to have care.
So now I get to put on my compliance officer's hat and play devil's advocate and bring this question into the mix.
Oh,
with everything,
man.
With everything else I have going on, you're telling me I have to do HIPAA. You're telling me I have to do all these other things. I don't have time for all that. And now you're telling me I have to carry on dialogues with my patients and show them about the portals and make them comfortable and tell them about my backup and recovery and my training and all that, which I probably don't do. But, how do I have time to do all that? I don't even have time to do HIPAA.
Well, part of that, is it comes with developing the materials and procedures And like I say, anybody having that conversation with them, it's the difference in, some healthcare providers they're not as quick, let's say, at making the transition to understand that you are working in a consumer-based occupation.
Mm-hmm.
That consumers do have choice. And that whole thing about letting me choose my doctor that everybody goes on and on and on about when they talk about healthcare reform, they want to be able to choose my doctor. Yet many practices act like I'm the only one. You show up, you don't, I don't care. Or I won't say practices. Let's say some staff members do that. How about that?
Yeah.
And when you come to the front desk, and if I'm just shoving some paper at you, it's very different than saying, okay, let me tell you about this form and tell you what this is for. Or, create little bitty cubby holes where everybody goes in and they watch a video with people talking to them, that you walk out the door and you see that person. Or it's the CEO, or it's the doctor, it's and every single person is on that video talking to them about here's how it works.
Mm-hmm.
And instead of sitting out there watching the news or any of the home fix-it shows and stuff like that, have some rotating videos going on out there. There's a lot of different ways to do it without spending time, but you've got to spend the time to decide and come up with it. But we have great technology that's allowing us to do a lot of things. Like these podcasts allow us to clone ourselves.
That's a scary thought.
Yeah. Well, no one wants any more than the knowledge we have and what they have to put up with to get it out. That's it. They don't want the rest of it. But in training the staff and taking that approach of this is customer service, this is caring for your patients. So it's happening across the board, not just one person sitting down and spending 15 minutes.
Well, I think what you're talking about is something that we use all the time. We call it an onboarding process. And that's something I think that's missing in healthcare, at least where I've been, is, I walk in as a new patient and I fill in all these forms, and then eventually they call my name, the doctor sees me, gives me a prescription, I'm on my way. But there's not a process in which I feel like I am brought into the practice as a patient. So I'm not being onboarded, so to speak, so that I know everything. And like you said, I don't see the videos. I don't know who the staff are. I don't know what they're doing to protect my information. I don't even know what really happens to my information once I hand it to somebody. So, all these things we talked about, transparency, dialogue, security, technology, training, backups, all that can be done, like you said, through email marketing and video. I hate to call it marketing. I mean, email training and video training and all those things you create one time. And by leveraging standard operating procedures, you can make all these things happen over and over and over again without them costing you more time.
Yeah. And I mean, recording these videos now, come on. It's Facebook Live. You don't have to have these super professionally made ones. You have some bullets, and you got to have somebody that knows what bullets you want to get across, and you figure out who's going to just, I hold up my phone and record them. Don't. In fact, I think it's better to do that because it's a much more comfortable kind of approach, is to say, hey, I'm really glad you're joining us, and it ups the game in your customer service, if you will. It ups the game in your patient care. It ups the game in your high-tech look. And so there's a lot of reasons, but it's called being creative and not saying, well, now I've just got to do it the way I've always done it. Let me sit down and add in 10, 15 more minutes of discussions with the patients. Find other ways. There's plenty of technology out there, and it's not really complicated stuff. And everybody always says, maybe not to you, but if you see how many people are on Facebook Live and Instagram Live and all of those things, it is, and YouTube, come on. Those are not professionals. Those are not professionally done videos.
And if you want to hire somebody to help you with that, then look me up.
Yeah, David loves that stuff. I can't tell you how much it drives me crazy.
I can make you a star.
But there's a lot of ways. Let's just say that. You be creative, but you don't have to spend a lot of money to do that either. You know, it's there's a lot of different ways that we could do it. And you've been creative, you know, with the Chromebooks and all this kind of stuff. So it's having good people that are advising you and then figuring out your own systems and just sit down and you have a push for 1 quarter and then you're done. And you look, you know, you're better off and you update it from time to time.
That's true.
So there you have it.
There you have it, folks. So that's our podcast for today. We want to thank everybody for listening. Remember, you can review us on iTunes. Where else can you review us? Google reviews? Anywhere else? Stitcher. Good. Go to all those places. We expect a whole bunch of new reviews. Don't forget.
So you can get your name in the hat.
Oh, yeah, absolutely. Don't forget what we talked about at the beginning of the podcast. If you need to, go back and listen to it, how you can get your name in the hat for the $100 Amazon gift card. Remember the HIPAA boot camp. This will be the first one that we're doing. I don't know how often we'll be doing these. We are getting a lot of buzz about it, so we may be doing them more often, but we don't know where they're going to be because we're having some people that are asking for us in different parts of the country. But one thing we do know for sure, being that this is the first one that we're doing, we're definitely going to do it as inexpensively as possible. So that's my way of saying it's not going to get any cheaper, so get in now. Because I've had people ask, you know, do you think the price will go down? I'm like, no, it's not. It's going to go up.
You think about it. It's what, $750 a day for 2 full days of training. You can't go to a conference for that.
No, you can't. I mean, Donna has worked hard to get the price down to what I think is beyond reasonable and appropriate. So take advantage of it now while we have it that affordable, because it definitely won't be that affordable again. I can guarantee you that. So go to thehippabootcamp.com or helpmewithhippa.com/bootcamp for more information on that. So anything else, Donna, before we close it off?
No, I'm good.
All right. Very good. So remember, for Donna and myself, that HIPAA is not about compliance. It is about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.